Hey guys, welcome to our presentation. This is created by Aurora, Brenda, Kaylee, Laura, and Paige. Today we're going to be talking about anesthesia. We'll be talking about local anesthesia, opioids, and also postoperative considerations for a patient. So I hope you guys enjoy.
Local anesthesia can be used in the form of topical administration, infiltration anesthesia, field nerve block, or intravenous regional local anesthesia. Topical local anesthesia includes the application of a cream, lotion, ointment, or a drop of local anesthetic to traumatized skin to alleviate pain. Topical local anesthesia can also be applied to mucous membranes in the eye, nose, throat, urethra, anus, rectum to alleviate pain or to anesthetize the area for a medical procedure. Infiltration local anesthesia is injecting the anesthetic directly into the tissue that will be treated. The anesthetic comes into contact with nerve endings in the area injected and prevents them from transmitting nerve impulses into the brain. Field block local anesthesia involves injecting the anesthetic all around the area that will be affected by the procedure or surgery. This form is more intense than infiltration anesthesia because this form comes in contact with all the surrounding nerve endings in the area. Field block is commonly used with tooth extraction procedures. Nerve block local anesthesia comprises injecting the anesthetic along with the nerve or nerves that run to and from the region in which the loss of pain sensation or muscle paralysis is desired. There are several types of nerve blocks, including peripheral nerve block, which is the blockage of sensory and motor aspects of a particular nerve for the relief of pain or diagnostic purposes. Another is central nerve block, which is the injection of anesthetic into roots of nerves in the spinal cord. This is usually used for surgery of the arms, hands, legs, feet, or face. Another is epidural anesthesia, which is injection of the drug into the epidural space where the nerves emerge from the spinal cord. This is usually used during labor. Another is caudal block, which is the injection of anesthetic into the sacral canal below the epidural area. This is common in perioperative analgesia in adults. And then another is spinal anesthesia, which is the injection of anesthetic into spinal subarachnoid space that is generally used for surgery of the lower abdomen and legs. Intravenous regional local anesthesia involves draining all the blood from the patient's arm or leg and securing a tourniquet to prevent the anesthetic from entering the general circulation, and then injecting the anesthetic into the vein of the arm or leg. This is used for very specific surgical procedures.
So my question is, what are the potential adverse effects with these medications, with the local anesthetics? And the possible adverse effects for these could be nausea and vomiting, as we always see in pretty much any medication. And there could be a loss of skin integrity as well due to the immobility because of the anesthesia. CNS effects such as headache, restlessness, anxiety, dizziness, tremors, and blurred vision, and also backache. And there could also be cardiovascular effects such as dysrhythmias, myocardial depression, and blood pressure changes, which all could lead to cardiac arrest. My next question was, why is epinephrine sometimes added to a local anesthetic? And this can be added, as we know, epinephrine is a sympathomimetic drug, and it can help slow down the progress of the absorption from the local anesthetic, and it prolongs the effect of it.
So my question was, what are the different types of drugs used in balanced anesthesia? The concept of balanced anesthesia is defined as combining several different types of drugs to achieve the maximum therapeutic effect needed during anesthesia. The variety of drugs given during balanced anesthesia achieve analgesia, muscle relaxation, unconsciousness, and amnesia. Some of the common agents used during balanced anesthesia are: 1. Pre-op medications such as the use of anticholinergics to decrease secretions with intubation and mechanical ventilation, and to prevent the side effect of bradycardia that naturally occurs with CNS depression. 2. Antihistamines such as diphenhydramine are used to decrease the chances of an allergic reaction and assist in drying up secretions. 3. Narcotics such as Dilaudid or morphine provide pain relief and added sedation and sense of well-being. 4. Sedative hypnotic drugs such as barbiturates and benzodiazepines are utilized to relax, facilitate amnesia, and decrease sympathetic stimulation. These drugs put a patient in a very relaxed and dreamlike state and ensure that they do not remember the procedure. Examples of these drugs are propofol, midazolam, ketamine, and thiopental. And finally, antiemetics are used to decrease nausea and vomiting associated with the use of all these anesthetic drugs that can have a side effect of GI activity slowing. One example of an antiemetic is ondansetron.
So the next question was post-operative considerations. You want to ensure that your patient is comfortable. You must ensure the patient is in a comfortable and appropriate position, and you want to turn them frequently. Pain control is a big thing. You want to prescribe medications, such as pain medication, and make sure you are completing a full pain assessment. Provide pillows and blankets as requested. The next thing, you want to make sure your patient is safe. You want to monitor their level of consciousness, assist with the activities as tolerated, and you want to get them mobilized as soon as possible. Question any orders you do not agree with. The next one is monitor airways and respirations. Make sure your patient has functioning airways that is providing the patient with adequate oxygen. If oxygen therapy is required, make sure you're properly functioning, that it is properly functioning and providing proper therapeutic effect. Watch for respiratory depression and assess for any adventitious lung sounds. Next is monitoring the level of consciousness. You want to make sure it is appropriate with the recovery stage. If rapid changes occur, it's not a good sign. They could be in shock. Next, you want to be assessing the wounds or IVs. Monitor for signs of infection, such as drainage, redness, and fever. Make sure proper techniques are being used when you are doing dressing changes. Make sure your IVs are intact and properly functioning. You also want to monitor inputs and outputs with these patients. Make sure their gag reflex returns, monitor for vomiting or aspirations, and make sure proper nutrition and fluids are being supplied. Also make sure systems return to regular functions. Another big one is patient education. Once the patient can, you must provide the patient with the education on the post-op care, such as incentive spirometers and deep breathing exercises, SCDs with manageable activities, and how to assess for infections. Go Huskies!
Opioids are drugs used for pain. The most common adverse effects that can be seen when giving opioids are respiratory depression, orthostatic hypotension, drowsiness, nausea, constipation, and biliary spasm. Patients may also experience confusion, anxiety, sedation, and urinary retention. As nurses, some interventions that can prevent and manage these effects are providing your patient with a laxative, since constipation is one of the most common side effects. You want to encourage your patients to maintain adequate fluid intake. Monitor for orthostatic hypotension and dizziness before and during ambulation. Know that if your patient had a recent GI or GU surgery, the need to monitor bowel sounds and INOs is extremely important, since opioids slow these systems down. You can provide supplemental oxygen and place patient on continuous pulse oximeter and continue to monitor and assess respiratory functioning throughout their use. If nausea occurs, you can take the medication with food. And client reorientation may be necessary. Explain to your patient that this could be a side effect of medication and should pass with time.